In a political landscape fraught with controversy and skepticism, White House Press Secretary Karoline Leavitt has ignited a firestorm by demanding accountability from top aides of the previous administration. Allegations of concealed health issues and questions about presidential decision-making have thrust the Biden administration's transparency into the spotlight. This exposé delves into the unfolding narrative, examining the historical context, the main events, and the potential long-term implications of these revelations. The Biden administration, inaugurated in January 2021, pledged to restore trust in government through transparency and integrity. However, concerns about President Biden's cognitive health emerged early in his tenure, fueled by occasional verbal missteps and a notably subdued public presence. These concerns intensified following the release of Special Counsel Robert Hur's report in early 2024, which described Biden as a sympathetic, well-meaning elderly man with a poor memory. The report's implications raised questions about the president's capacity to fulfill his duties effectively. As the 2024 presidential election approached, Biden's performance in debates and public appearances came under scrutiny. Critics pointed to instances where the president appeared confused or required assistance, suggesting a decline in cognitive function. Despite these concerns, the administration maintained that the president was fit for office, attributing any lapses to the natural aging process. In June 2024, Biden withdrew from the presidential race, citing personal reasons. Vice President Kamala Harris assumed the Democratic nomination, but ultimately lost the general election to Donald Trump. Following the election, revelations about Biden's health surfaced, including a diagnosis of stage 4 prostate cancer. The aggressive nature of the disease and its progression raised questions about when the diagnosis was made and whether the administration had concealed information from the public. In May 2025, White House Press Secretary Karoline Leavitt publicly demanded answers from top aides of the Biden administration regarding the concealment of President Biden's health issues. Leavitt specifically called for former First Lady Jill Biden and White House physician Dr. Kevin O'Connor to testify under oath about their knowledge of the president's condition. She accused Jill Biden of being complicit in a cover-up, stating, "She's still lying to the American people. She still thinks the American public are so stupid that they're going to believe her lies." Leavitt's demands were echoed by House Oversight Committee Chairman James Comer, who sent formal requests for testimony to several Biden administration officials. Comer emphasized the need for transparency and accountability, asserting that the American people deserve to know the truth about the president's health and the decision-making processes within the administration. The controversy intensified with the release of Original Sin, a book by CNN's Jake Tapper and Axios's Alex Thompson, which claimed that senior members of Biden's administration were aware of the president's cognitive struggles and actively hid the information from voters. The authors alleged that Biden was only one of 5 people running the administration, raising concerns about the legitimacy of executive actions taken during his presidency. The allegations sparked a wave of reactions across the political spectrum. Supporters of the Trump administration viewed the revelations as confirmation of their long-standing concerns about Biden's fitness for office. They argued that the concealment of the president's health issues constituted a betrayal of public trust and warranted thorough investigation. Conversely, critics accused Leavitt and the Trump administration of politicizing the issue for partisan gain. They contended that the focus on Biden's health was a distraction from pressing national concerns and an attempt to undermine the legitimacy of the previous administration. Some commentators also questioned the motives behind the timing of the allegations, suggesting they were strategically released to divert attention from current controversies. Medical experts weighed in on the discussion, with some expressing skepticism about the feasibility of concealing a stage 4 cancer diagnosis for an extended period. Dr. Stephen Key, who has not treated Biden, noted that such progression typically takes 5 to 7 years, implying that the disease may have been known to the president's inner circle long before it was disclosed. The unfolding controversy has significant implications for public trust in government institutions. If the allegations of a cover-up are substantiated, they could erode confidence in the transparency and accountability of the executive branch. The situation also raises questions about the mechanisms in place to assess and address a president's fitness for office, particularly in cases involving health concerns. Political analysts suggest that the controversy may influence future electoral processes, prompting calls for more rigorous health disclosures from presidential candidates. The debate also underscores the importance of clear communication between the administration and the public, especially regarding matters that directly impact national leadership. Furthermore, the situation may prompt legislative action aimed at enhancing oversight of the executive branch. Lawmakers could consider implementing measures to ensure greater transparency in the president's health evaluations and decision-making processes. Such reforms would aim to prevent similar controversies in the future and reinforce public confidence in governmental operations. The demands for transparency regarding President Biden's health have ignited a complex debate about accountability, public trust, and the integrity of governmental institutions. As investigations unfold, the nation grapples with the implications of these revelations and the steps necessary to uphold democratic principles. Stay informed about the developments surrounding this controversy and its impact on national governance. Engage in discussions about the importance of transparency and accountability in leadership. Your awareness and participation are vital in shaping a government that truly serves its people.